about how weekend warriors cram a lot of activity into Saturday and Sunday because that's the only time they may have, and it's not a bad thing. But just want to ask, does this make it safe to say that they might be prone to injuries, maybe more than others, or how does that compare?
Yeah, absolutely. Remember, a lot of these people have not been exercising or undertaking a lot of physical activities for months, sometimes even years. So of course, as we get older, things get a little stiffer, things get a little tighter. But up here, we all still think we're 21.
Absolutely.
So some of us played those sports in the old days, and we want to get back into that because we know it's going to help us. Our doctor has maybe recommended we try those activities. So yeah, injuries are more prone to people in these categories for the, just for the simplest of reasons, and certainly much more serious injuries as well.
Okay, speaking of those, doctor, several articles I've read along with some war stories I've heard from friends of my own point to a group of injuries that are very common involve the Achilles tendon, and specifically an Achilles tendon rupture. So, doctor, I guess if you want to tell us a little bit about the Achilles tendon and what makes it kind of susceptible and what can happen. And I know that we actually have a biodigital image for you to reference as you tell us about that.
Yeah, this is a great image to illustrate what we're talking about. Here's the Achilles tendon, which is the tendon that joins the heel bone to the calf muscle. And you can see from this picture, this person's in big trouble. They have a complete rupture of the Achilles tendon. They're most likely going to require surgery and be in a boot and be out of action for probably even a few months. Fortunately, in modern times, we have wonderful treatments for these types of problems. This would usually be handled by a podiatrist or an orthopedic sports medicine doctor. And he also can be expected to recuperate probably close to 100%, but he's going to be down for a while, and that is going to put a damper on his exercise program as well as have a lot of pain and discomfort.